Well, good afternoon. Wish we were meeting for different reasons, but I thought it wise for us to have an opportunity to engage our community and provide an update. This may be the first of many more updates, certainly nationally, regionally, within the state. A lot of anxiety has occurred just in the last 48 hours. I want to reiterate that in Taylor County, in our community, there have been no positive tests thus far. Feel very, very confident. Annette Lerma, who will speak in a bit, Director of Health Services, has done just an outstanding job of engaging the local stakeholders, as well as those at the state and federal level, and being sure we're doing all the right things. Certainly because of the circumstances in the last recent days, small business in our community has been affected. And so we don't want to cause any undue anxiety, but we want to be sure that you know that we are preparing ourselves. And so this is all about being prepared and not trying to communicate any kind of panic, but we want you to know that all of us, all the stakeholders in this community are working very, very hard to be sure that we are ready. Robert Hanna, our city manager, will provide an overview of what does this mean for city services. Everything from the library and Parks and Rec, what does that look like in regard to services? We'll also have Annette Lerma, who will talk to you about reiterating some things that we want you to know about where we are now and where we will need to pivot if we need to pivot. We'll have both superintendents, both Dr. Young as well as Joey Light. We'll talk about some decisions they've made with their board in regards to instruction of our children. Again, I want to reiterate that there are no positive cases in our community, that due diligence has and is being done. I feel so very confident about the leadership of this community of handling things in an appropriate and correct way. It will be a chance for you to ask questions of any of us if we need additional clarity. The whole purpose of today is provide a chance for this community to be aware of what is going on, the thought process behind that, and also to instill confidence that we are doing all the due diligence. Thank you. Mr. Robert Hanna.
Thank you very much. My message today is that we need to remain calm as a community. We don't need to panic. We have an opportunity now to limit or restrict the outbreak of this disease in our country, state, and city if we all exercise a little West Texas common sense. Currently, there are no confirmed cases of coronavirus or COVID-19 in Abilene or Taylor and Jones counties. We are in constant communication with local, state, and federal agencies regarding the situation. The Abilene-Taylor County Public Health District will provide guidance and recommendation to our community partners as this situation evolves. Your community leadership has been meeting regularly on COVID-19 response and will continue to do so for as long as necessary. Our medical community is prepared to respond if and when needed. Again, I'd like to reinforce, just as the mayor has a number of times, that we currently have no known cases within the city of Abilene or Taylor and Jones counties. The situation is evolving rapidly and changes day to day. Regular updates will be provided online at www.abilenetx.gov/health, as well as on the City of Abilene and Abilene-Taylor County Public Health District social media accounts. Easy and automatic delivery of this information is available by signing up for notifications on www.abilenetx.gov/notify-me. The City of Abilene is prepared to act swiftly and remains committed to the health and safety of our citizens. City services will remain fully operational until such time the situation dictates otherwise. I will not hesitate to temporarily close libraries, recreation centers, the senior center, the convention center, the zoo, or any other municipal public place if the health of the public requires it. The provision of municipal utilities will continue uninterrupted during this period. The CDC just moments ago released some guidelines for public drinking water, and they have said fairly definitively COVID-19 is not present in municipal drinking water if it's treated properly. All of our drinking water is properly treated, so citizens don't need to worry about getting COVID-19 from their drinking water. Any changes to municipal services will be communicated to our community partners, the local media, so that our citizens can stay fully informed. Internal to the City of Abilene as an organization, in support of Governor Abbott's own changes to the state's workforce, and effective immediately, I am suspending all employee travel. Those employees who have traveled to Washington State, New York, California, or the District of Columbia, or any out-of-country travel, or as otherwise required by me, will be required to self-monitor for a period of 14 days from their homes until returning to the office. If the job lends itself to telework, they will be required to work remotely during this time. Employees who are ill will be sent home if they come to the office. Employees who are ill will not be charged sick leave during this limited window of time. I do not want someone to say, I don't have enough leave balance, and they choose to come to the office. They should stay home. Some employees may choose to telework because they have a family member or loved one that is particularly susceptible to COVID-19. These requests will be approved on a case-by-case basis. Again, these are not requirements for the private sector. They're simply things I am doing for the City of Abilene employees. I've also been asked what churches should do. And while that's a decision for the church and their leadership, some ideas to limit potential exposure include limiting contact with the offering plate by placing it at the entrance or exit of the church, and people could leave their contributions in the plate, foregoing the shaking of hands during the sign of peace, and for those denominations that participate in the communal cup, perhaps they find an alternative way of doing that during this time. In closing, we need not panic. We will likely see cases of COVID-19 in Abilene, but we are prepared to deal with them. This is not the apocalypse, and a little West Texas common sense on the part of all of our actions will go a long way. If you're sick, stay at home. Wash your hands. If you're a member of an at-risk population, such as our elderly, or a member with an underlying cardiopulmonary condition, or compromised immune system, consider limiting your exposure to large crowds and participating in social distancing during this time. We will get through this, just like we have every other novel concern to our community. We will do it as a community that cares for one another. Thank you very much.